Welcome to the third session of the Healthy Heart, Healthy Life Pune series. Today we are going to focus on heart nutrition or nutrition of our heart and atherosclerosis. I am Dr. Nilkant Karandikar, Chief Cardiologist at the Heart Clinic in Mukundnagar, Alpha Diagnostic Center, Hirabag Chowk, Tirak Road. I am interventional cardiologist at the Ruby Hall Clinic, Deenanath Mangeshkar Hospital and Sahyadri Hospital, where I do procedures like angiography, angioplasty, pacemaker, implantation, etc. The post of Honorary Professor Emeritus in Cardiology has been conferred on me by the government of Maharashtra at the BJ Government Medical College and Sassoon Hospitals, Pune, and I'm the first gold medalist of the Bombay or Mumbai University at the DM Cardiology examination. The previous two sessions have had a fairly good response, but I look forward to a very good response, and I would urge all of you to subscribe to my channel and also give me a thumbs up. Let us begin with the topic. Our heart is full of blood in its cavities at all times. But for its own nutrition, it cannot absorb the oxygen contained in this blood or the other nutrients contained in that blood. For its own nutrition, our heart has to depend on two small arteries called coronary arteries. Here you can see this is the aorta, which is the large artery originating from the left ventricle, and it carries blood to all organs of the body. Right at the beginning, the first two branches of aorta artery are the right coronary and the left coronary. The left coronary has two branches, major branches called LAD and circumflex, and this is the right coronary artery. These coronary arteries travel on the surface of the heart, but as they are traveling on the surface, several branches take origin and dip down into the muscle of the heart, carrying blood to the entire muscular thickness of all the chambers of the heart. Here you can see that this coronary artery finally reduces in size, and at the termination it gives rise to capillaries, which are very, very small. Normally, when a child is born, the coronary arteries are absolutely cleaned on the inside, smooth, clean, and this is the cross section of the coronary artery. But as the age advances, a process called atherosclerosis, which is deposition of fats and some cells from the blood on the wall of the coronary artery, and this process is called atherosclerosis. Now, what is atherosclerosis? Atherosclerosis is a disease where sticky plaque builds up in the arteries. It is a major cause of death globally, linked to various diseases. How does it develop? Formation of plaque. Plaque is a layer of the atherosclerotic, substances on the wall of the artery. There is accumulation of cholesterol, fat, blood cells, and other substances in the artery walls. The impact is there is narrowing of arteries, reduces oxygen-rich blood supply to the tissues and organs over time. So this is the normal artery on the top, and this is the artery where the atherosclerotic plaque has developed. Atherosclerosis, in fact, begins in the childhood itself. If in the autopsy studies of children 12, 13 years old, boys and girls who died due to some accident, those autopsy studies showed that atherosclerosis had started developing in the arteries at that very young age. And then, as the age advances, the atherosclerosis progresses. The atherosclerosis is, deposition of fats and several cells on the walls of the arteries, like this person is throwing the cement on the wall. And this is a very nice video to explain how atherosclerosis develops. Atherosclerosis is a slowly progressive disease. The speed of progression changes from person to person. First, it depends on genetic background, and then it depends on the lifestyle of that person. The initial three stages, initial lesion, fatty streak, and intermediate lesion, they are not very severe, whereas the fourth stage called atheroma is where the intracellular fats is there and the fat also starts accumulating outside the cells. The next stage is fibroatheroma, where fibrotic veins, fibrotic fibers, and even calcium can get deposited here. And the last, the complicated lesion, is where there is a defect on the surface of this atherosclerotic plaque. It's called as a rupture of the plaque, and there is a hematoma or hemorrhage and thrombosis. So blood comes out of this plaque, and then once this plaque ruptures, it can cause a formation of a blood clot which will block the artery, and the person can get a heart attack. The most common site of atherosclerosis in the body is in the aorta artery, as it comes in the lower abdomen or stomach area and divides into two branches. Here the aorta is pretty wide, maybe 2 centimeters or slightly more in diameter. And therefore, even if there is a plaque, it does not cause significant obstruction. The number two site is the coronary arteries. We saw the picture, the coronary arteries supplying the heart. We know that this aorta at its origin, the big artery coming out of this left ventricle, is 3 centimeters in diameter, whereas the coronaries are hardly 3 millimeter in diameter. So when the atherosclerosis plaque deposition occurs in these coronary arteries, it can cause obstruction pretty early. The next is the arteries of the lower limbs, number 3, and 4 and 5 are the arteries supplying the brain. So first the coronaries, then the lower limbs, and then the brain. Atherosclerosis, when it develops in the coronary arteries, they can cause obstruction, creating chest pain, angina, and even heart attacks. In the carotids, they can cause stroke, as we say, hemiplegia, weakness on one side of the body, etc. And in the lower limbs, they cause intermittent claudication with pain on walking. Here it is shown when the atherosclerosis occurs. Here it is a block in the left coronary. Here is shown a block in the right coronary. So such blocks are the result of atherosclerosis. This is an important slide. When there is coronary artery disease, that is the artery supplying the heart, the impact can lead to chest pain, angina, and heart attacks. When it occurs in carotid arteries, location is the neck arteries, impact reduces blood flow to the brain, increases stroke risk. Stroke, you know all, what it means. It is hemiplegia or ardhangavayu, as it is called in Marathi. Peripheral artery disease, location primarily leg arteries, can also affect arms and pelvis. Impact, symptoms include leg pains, mobility issues, can lead to limb loss. Renal artery stenosis, location artery supplying blood to the kidneys, can lead to kidney damage, hypertension, high blood pressure. Vertebral artery disease, this is again the artery supplying the brain area. Impact affects critical body functions, can lead to severe complications. And last mentioned here is mesenteric artery ischemia. Location artery supplying blood to the intestines, can cause severe abdominal pain and digestive issues. So we can see that atherosclerosis can affect arteries all over the body. Now, what promotes atherosclerosis? To begin with, let us talk about genetics. What is your genetic background? You cannot change it. If it is bad, you will develop atherosclerosis early. If it is good, like Winston Churchill had probably good genetics, he was a heavy smoker of cigars but did not develop problems till late in his life. Then age, gender, this is something you cannot change. Then there are lifestyle issues like radiation, air pollution, heavy metals, free radicals. But more important than this is the environmental smoking, unhealthy diet, physical inactivity, stress. All these promote atherosclerosis. And the modifiable ones, obesity, increased body weight, increased blood fat levels, high BP and diabetes. So all these will cause atherosclerosis. Somebody has said, one Mehmet Oz, your genetics loads the gun, your lifestyle pulls the trigger. Now, what can you do to prevent atherosclerosis? You have to live a healthy lifestyle, healthy diet, regular exercise, adequate sleep, and stress control. We are going to discuss each of these in detail in subsequent sessions. Then, what about the treatment of what conditions is important? Blood pressure management, diabetes management, cholesterol or fat management, and weight management. These are very, very important. Can atherosclerosis be reversed? Yes, those who follow a healthy lifestyle, you can see here there was a block in this artery, LAD, the very important artery of the heart. So before treatment, lifestyle modification and cholesterol modification, after 1 year, you see the block has reduced, and after 4 years, it has reduced further. The block here is not significant at all. So if you have atherosclerosis, it does not mean it cannot be reversed. Start living a healthy lifestyle, about which we will talk in subsequent sessions, and the atherosclerosis can be reversed. Key points from today's talk. Healthy lifestyle is also helpful. Earlier we start, the better it is. It is not also helpful, it is definitely helpful. Once established, atherosclerosis may be regressed to a variable extent. Both reduction in plaque size and plaque stabilization mean regression. Dean Ornish uh, showed in a study which extended over 1 year that people who follow healthy lifestyle, the atherosclerosis can be reversed. Maintaining low LDL cholesterol throughout one's lifespan is one of the most effective ways to prevent atherosclerosis. Lipid lowering therapy is the most useful for this purpose. So many things are useful, and we are going to discuss one by one in our subsequent sessions. Thank you very much for attending this session. I hope you liked it. I am going step by step, and let me tell you that I will again urge you to subscribe to my channel, also to give me thumbs up. I'll feel encouraged, and I'll definitely give you more and more good information about the heart, how to stay healthy, and how to maintain excellent, uh, how to lead an excellent life. Thank you again. Thank you very much.